My name is Dr. Wayangankar. I'm a first-year cardiology fellow at University of Oklahoma, and today I'm going to discuss about the study which we did with NCDR Action. The idea behind this study is to see if landmark trials like Equity, Horizons AMI, and Replace 2 and early ACS, whether these results of these studies have changed the way we use anticoagulants, whether the excess dosing has changed, and whether associated with these changes, whether we have seen any changes in the outcomes, which mainly bleeding and mortality. We started with a sample size of around 64,199 patients. All of these were non-STEMI patients who were managed invasively, and the trends that we have observed in this, after analysis of this study, we have observed that the use of bivalirudin and unfractionated heparin has continued to increase from 2007 to 2010, and this is a hospital-based data. So the proportion of these two agents have continued to increase, whereas the proportionate use of low molecular weight heparin and GPIs have continued to decline. When we assessed the GPI, this is especially in regards to early ACS trial, we wanted to see if after the publication of early ACS trial, the provisional versus upstream versus downstream use has changed or not. And we see that when we just analyze the GPI use, we have seen that the downstream use of GPIs has considerably gained more importance or has been favored by physicians more. Whether this is to limit bleeding based on what we noted from early ACS is a matter of speculation at this moment. Most importantly, we studied excess dosing for all antithrombotic agents, and this includes unfractionated heparin, we have unfractionated heparin, GPI, and low molecular weight heparin. As you can see from the figures, the excess dosing from 2007 to 2010 has drastically dropped from unfractionated unfractionated heparin and for GPIs, whereas the low molecular weight heparin has kind of shown a static trend. There is no decline or increase. It's remained pretty much static. Important thing that we noticed in clinical outcomes is that associated with these changes that we see in the use of antithrombotic agents and the excess dosing of antithrombotic agents, we have noticed that the action major bleeding or clinically significant bleeding has significantly decreased, although mortality and myocardial infarction rates have remained unchanged. So what we would like to showcase from this study is that changes have started to occur in the way we use antithrombotic agents. Most whether these are secondary to the publication of landmark trials is a matter of speculation, but we believe that they have played a major role in the way we have perceived bleeding as a risk and bleeding as an outcome, and therefore tried to change the way we use these antithrombotic agents in our practice. Just to conclude, we have noticed that from our study results, we have noticed that the landmark trials have started making an impact in our cardiology practice in a way we use anticoagulants. Antithrombotic agents have shown a trend where more preference has been given to use of bivalirudin. Most importantly, however, we believe that we have realized the importance of excess dosing and the impact that it can have with regards to bleeding outcomes, and therefore it is heartening to see that the excess dosing results have continued to decline, and we believe that this in a combination with other landmark trials, the realization of excess dosing has made a significant impact in the decline in the clinically significant bleeding rates during the same time period.